A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a significant move that has drawn widespread criticism, the Trump administration announced new proposed regulations on Thursday targeting gender-affirming care for youth, furthering a controversial agenda from the Department of Health and Human Services, HHS. These proposed regulations aim to restrict access to crucial healthcare services for transgender minors, a demographic already facing significant barriers to care. One of the most alarming aspects of the proposed rules is that they would prevent hospitals providing gender-affirming care to minors from receiving federal Medicaid and Medicare funds. Additionally, the regulations would prohibit Medicaid from covering gender-affirming care for individuals under 18 and would similarly restrict coverage under the Children's Health Insurance Program, CHIP, for those under 19. HHS Secretary Robert F. Kennedy Jr. spearheaded the announcement during a Thursday morning event, where he characterized gender-affirming procedures as sex-rejecting and claimed they inflict lasting harm on children. "This is not medicine. It is malpractice," Kennedy declared, asserting that the administration is committed to moving away from what he termed junk science that does not prioritize the well-being of children. The proposed regulations come amidst a backdrop of growing scrutiny and legislative action against gender-affirming care across the United States. Major medical organizations have consistently supported gender-affirming care as a necessary treatment for gender dysphoria, which can include the use of puberty blockers and hormone therapy. These interventions have been shown to significantly reduce depression and suicidal ideation among transgender and non-binary youth. The Human Rights Campaign, the nation's largest LGBTQ+ advocacy organization, condemned the proposed regulations, stating they would effectively deny access to medically necessary health care for transgender youth across the country. Kelly Robinson, president of the Human Rights Campaign, emphasized that these rules would remove critical healthcare decisions from families and place them in the hands of politically motivated officials. Make no mistake, these rules aim to completely cut off medically necessary care from children no matter where in this country they live, Robinson stated. The proposed regulations will enter a 60-day public comment period, during which stakeholders and the public can voice their opinions. This move follows the U.S. Supreme Court's recent decision to uphold Tennessee's ban on gender-affirming care for minors, with approximately half of U.S. states now implementing similar restrictions. Furthermore, a vote by the United States Conference of Catholic Bishops has led to Catholic hospitals being barred from providing gender-affirming care to minors. In a related legislative effort, the U.S. House recently passed a bill that criminalizes healthcare providers who offer gender-affirming care to minors, although the bill is not expected to pass in the Senate. Alexis McGill Johnson, president and CEO of Planned Parenthood Action Fund, characterized the proposed regulations as shameful, highlighting the organization's commitment to providing gender-affirming care alongside other reproductive health services. She asserted that all individuals deserve access to evidence-based healthcare and education to make informed decisions about their health. During the announcement event, Dr. Mehmet Oz, the administrator of the Centers for Medicare and Medicaid Services, CMS, noted that over half of children in the United States are covered by Medicaid and CHIP, underscoring the potential impact of these regulations on access to care. Additionally, Kennedy mentioned that the FDA is sending warning letters to manufacturers of chest binders marketed to youth under 18, further signaling the administration's intention to regulate gender-affirming products. The proposed regulations also aim to reverse protections against discrimination based on gender dysphoria established under the Rehabilitation Act of 1973 during the Biden administration. This recent push aligns with an executive order issued by President Trump in January, which condemned youth gender-affirming care as chemical and surgical mutilation, despite the fact that most transgender youth do not undergo surgical procedures. A comprehensive review released by HHS in May criticized gender-affirming care while acknowledging a lack of substantial evidence of harm. Chloe Cole, an activist who detransitioned after receiving gender-affirming care as a teenager, spoke in favor of the proposed changes during the announcement. She expressed her desire to raise awareness about the experiences of detransitioners, stating, "I detransitioned, and I chose to face the world and sound the alarm on what is happening to my generation." Cole's perspective has been utilized by some Republican lawmakers to bolster their campaign against gender-affirming care. However, experts caution against using the experiences of a small group to justify broad healthcare bans. Logan Casey, director of policy research at the Movement Advancement Project, noted that such actions could deny necessary healthcare to a larger population based on the experiences of a few. In response to these developments, Oregon Senator Ron Wyden, the top Democrat on the Senate Finance Committee, criticized the Trump administration's actions as an attempt to demonize and erase transgender Americans. He stated, "Trump's latest effort to bully hospitals into carrying out his extremist agenda is a cruel and thoughtless step that contradicts medical evidence and will jeopardize healthcare for many communities around the country." As the proposed regulations move forward, the implications for transgender youth and their access to essential healthcare services remain uncertain. Advocates and healthcare providers are calling for robust public engagement during the comment period to ensure that the voices of those affected by these policies are heard. The ongoing debate surrounding gender-affirming care continues to highlight the intersection of politics, healthcare, and the rights of marginalized communities in America. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.